Many know her with the title Dr. Olive Shisana, particularly during her life at the HSRC, which is the Human Sciences Research Council. But Dr. Olive Shisana has been involved in a number of areas than just the HSRC. Previously, she was part of the World Health Organization, and now she has assumed another life. She has got extensive experience in research, in policy development, and in various aspects of public life where she has spent most of her life. Dr. Shisana, Professor Shisana, welcome to the program.
Thank you very much.
We're happy to have you here. I understand that you are here now as a part of the panel, the high-level panel, which assesses the impact of legislation enacted and passed by this parliament since 1994.
That's correct. I am a member of that panel, and I also chair the working group that's actually looking at the issues related to inequality, poverty, wealth distribution. So those are the areas that I'm interested in.
We spoke to the chairperson of the panel earlier on, Ndate Kgalema Motlanthe, and he also introduced you representing that area. It's a mouthful. I mean, there's quite a number of issues that are linked within the scope and responsibility of the committee that you chair. Just help us to understand what is the link between these various variables: inequality, poverty, unemployment, wealth creation, and distribution.
Yeah, I think historically this country has had serious inequalities that resulted in many people becoming very poor. Most of the time we used to be looking at only the question of poverty, but we really didn't look at the question of inequality. And yet inequality is a major contributor to poverty. And wealth distribution is also a key in terms of determining who's going to have what and or not have what. In other words, it contributes to the question of inequality too, and then contributes also to poverty in turn. Wealth distribution also is key to the question of unemployment. In our country, we have about 26% of the population that is unemployed, if you exclude the discouraged workers. Now, with so many people that are unemployed, obviously it means that they cannot provide resources for their families. It means they cannot provide resources for their own living. So their own standard of living is going to be affected by whether they're employed or unemployed. So when you look at all of these things, you see that they boil down to the fact that there is unfairness in the system. Somewhere there is some unfairness that lead other people to be poor, that lead other people to have more resources than others. I'm not saying that we are looking for a society where everyone would have the same resources. That's not possible. But what we're trying to look at is whether we can narrow down those inequalities so that even the poorest should still be able to make ends meet. And this committee is going to be looking at the impact of the legislation that has been passed since 1994 and what impact has it had on the ordinary lives of people insofar as the issues of poverty, unemployment, inequality, and wealth distribution.
I'm sure many of the issues that you're going to be grappling with in the course of your work, Professor Shisana, are not really new to you. You've been at the HSRC. In your current work now, you're working very close with societies, with the people on the ground. I'm sure you have a sense as to whether legislation up to now has had the kind of intended outcomes, or if you think there are gaps. I don't know if you'll be able to give me a glimpse into your own viewpoint as far as that is concerned.
Let me take an instance of health, which is an area of also my own expertise. You look at the healthcare system, it's divided between public and private. And essentially it's the division of the haves and the have-nots. Because if you look at, for example, who has access to private healthcare, largely it's still a white population that has got access to private healthcare through medical insurance, medical aid. The African population, about 10% of them actually have access, to medical aid that will give them access to the private health care. So the majority of the people, you're talking about more than 75 to 80% of the majority of the population use only the public sector. And when they go to the public sector, they find facilities that are overloaded, overcrowded, and they find facilities that are not well resourced. They don't have enough doctors, they don't have enough nurses, they have to queue in. Sometimes they have to come in at 4 in the morning just to be able to get healthcare. But if I am one of the 10% African, or I'm a white person or a colored or Indian, I don't have to do that. All I have to do is to pick up a phone and call and make an appointment and say, I'm coming in to be seen. They say, okay, come in at 11 o'clock. I go then at 11 o'clock. They would have done their 15-minute view of seeing each patient, and my 10 comes and I get to be seen and I go. So I have more time as a well-to-do person to go out and work and generate income and all that. But if I'm a black person and part of those people that have got to the public sector, it means I have to stand in a long line and lose a day of work, which I cannot afford, to lose. So those are some of the inequalities that we want to look at. And we're saying, what laws have been passed in South Africa that would have addressed this kind of things? Well, we've been waiting for the National Health Insurance to come into effect, to become an equalizer, to ensure that you can be able to redistribute the number of doctors that you have, the financial resources that you have, medical devices that you have, so that everybody should be able to access healthcare when they need it. It will be determined by the need rather than by the financial resources that one has. So that's one law that should have been passed a long time ago. The Health Act, for the one that was passed on the National Health Act that was passed around 2003, did not go far enough in terms of integrating the public and the private and addressing the question of inequality. We now need a law in the National Health Insurance that is actually going to do exactly what is necessary to do to end inequality.
If I may just ask this question, the 5 areas where you're focusing, they're heavy. Each one of them is heavy. Unemployment, just on its own, you just gave us a broad outline of the percentages of people that you're talking about when talking about unemployed, people in poverty, etc., etc. And I also appreciate that your focus is with regard to the impact of legislation. Do you think we can, as a country, legislate ourselves out of these challenges?
I think we can. We could look at, for example, the question of procurement. One of the reasons why we're not able to get a lot of people who are poor to create jobs in poor areas is that the procurement requires that, or the procurement requirements are that the person who's submitting a proposal must have extensive experience of actually doing what it is they want to do. So in other words, if you're an entrepreneur who's very energetic, who's enthusiastic, who's got a good plan, but doesn't have those many years of experience, it means that that person is not going to be able to access those resources to start a factory in, let's say, a community of Mutiba, small community. You can't do that. Why? Because they say you don't have the experience to do that. And yet, by giving that person the opportunity to actually open up a company in Mutiba, they will be able to find a lot of people that will be willing to work because they will not have to have transportation problems. And even if they didn't earn a lot at the beginning, they probably would be willing to take up that job because it's in their own community. So can we pass those laws that change the way in which procurement is done to allow the entrepreneurs to also be able to open up businesses in the rural areas?
Surely, in going about your undertaking as a committee, you will need involvement of South Africans. How do you see them participating in the course of your project?
First of all, I want to say we as a panel don't have the answers. Right. We as a panel depend on several constituencies. The first constituency is the public. that needs to tell us what impact these laws have had on them. Some of them will know, some of them will not know. But there are many that are going to know that, look, since this law was passed, have I benefited or did I not benefit? Secondly, we need the input of scientists who are specialists in this particular area. So we're going to commission the work to them to come back to us with a clear sense of understanding of the lay of the land with regard to each one of the topics that we have, and explain to us what the problem is, how has it been dealt with, what legislation has been addressing this particular issue. Now, the third group, obviously, is really those people that are interested, professionals who are interested in providing information through oral submissions, who can come in and persuade us one way or the other to understand the issues as to what impact they've had. So we're going to be having hearings for the general public. We're commissioning work for the researchers. We're inviting people, specialist people, to come and present, oral submissions. And that's open. Anyone can come in, but they must know something about the subject to come in and share with us. So those are the three mechanisms that we're going to be using. And we're going to be going around the country from one province to the other, listening to these oral submissions and sharing with people what it is that so far we're hearing.
I like the latter part where you're creating these avenues for people to be part of it. You said you don't have answers reside with them. And you're dealing with these topics, inequality particularly, poverty. Poverty resides in the far-flung rural areas, not in the metros. How are you going to conduct these hearings, or how are you intending to accommodate the inputs from the people who really matter? Not that any other person doesn't matter, but people in rural areas, people in the provinces. How are you intending to conduct these hearings?
I think we need to go to the small towns, because small towns are not very far from the rural areas, and have hearings there and let people come in and listen to, what it is that we're asking, and then they giving answers to that. And I think the way we're spreading it to all the different provinces, there is an opportunity for that. We don't want to just advantage the people in the urban areas. We also need to advantage people that are in far out remote areas of the country.
What timeframes do you have to conduct the hearings and to garner that input?
Early August. So from that time onward, we'll be able to hear more and more of the hearings. However, there are also opportunities for the radio. We're planning to have like a radio discussion so that we have the general public to actually, give input. So we have that as an opportunity to bring out some of our experts to come in and talk so that we listen to what the public is saying. So it's a multi-pronged approach of actually getting input, from the public.
Professor Shisana, from your articulation of your strategy, collaboration with civil society organizations is central to your methodology, to your approach. Have you tested the ground? Is there enthusiasm on the part of civil society research institutions that you mentioned to be part of it?
Yes, because the people that we're commissioning to do the research who are experts, they're experts both from the research community as well as from the non-governmental organizations, because there are some non-governmental organizations that have been working in these areas for quite some time, and they are very enthusiastic, about, these particular issues. They bring in experience on the ground, but they also bring in, understanding of the area through research.
Now, what would you like to see happen to your report to the panel? What do you foresee as the content, the structure of that report? What should it address, in your view, before you even write it, before you even undertake your work? But I'm sure you've got a sense of what would you like to report about.
Okay, first we would like to report about what is the status at the moment of inequality, of unemployment, of wealth distribution, so that people understand the problem. You can't deal with the problem until you first understand what is the problem. Secondly, we would like to look at what are the laws that have been passed by Parliament, And to what extent have those laws been implemented to address these particular challenges that we've identified? And then would like to be able to say, what is the impact from the people's point of view? Because the people's point of view might differ from a statistical point of view. The statistics can give you something, but people might have not felt, that. And so we need to know how big a population it is that has not experienced that vis-a-vis that has experienced that, but flavor it with the real situation on the ground, from what it is that we've had. And then we'll be able to make some recommendations to say, well, perhaps Parliament needs to change this legislation to do this and this. Perhaps some of the legislation may need to be scrapped, that they haven't really done what it is that they were supposed to do. Instead, they needed a new legislation that is going to do the following. So that's the approach that I think that we might want to follow.
I think the outline extends up to the I would say the expiry of your mandate, if I could say, but your purpose does not expire. What would you like to see happen to that report?
That report would like to see Parliament take it, debate it, and use it. It was one of the conditions that we had. We wanted to find out, is this an exercise in futility? Or is it an exercise that is actually going to lead to something more concrete? And we're assured that once the report is submitted, it will be taken straight by Parliament and they'll take it very seriously, because it is one of their main strategic goals for this fifth democratic parliament to address this issue. So it's not, we're expecting a fertile ground out there in terms of them supporting the recommendations that come out of here.
But Professor Shisana, forewarned is forearmed. I don't want to be a prophet of doom, but you're saying you don't want, and you said the condition is that you don't want, and I'm sure this extends to the entire panel, to be part of an exercise in futility. What are the risks that could render this noble purpose an exercise in futility, in your view? What is the key, maybe 2 or 3 issues that would render it an exercise in futility?
It's when Parliament starts debating things to the point that they don't get anywhere and all they spend their time is talking past each other. If the parliamentarians start talking past each other, then they are not going to be serving the public, because we will be presenting to them what came from the public. So that's very important, for us. Number 2, we hope that there are no changes in Parliament up to the time that we finish this in terms of who the leaders are. So we'd like to see those leaders, continue to be there, hopefully, so that they can be able to take the recommendations that we've actually made. Yeah.
Can we read from your own passion and palpable energy that this is the orientation within the panel itself? Is everybody as committed and as passionate about your purpose as you are?
Yes, we are. We're passionate from different angles, in the sense that we have people that come in historically from the public sector. Some of them historically come from the private sector. And we are all enthusiastic, but in a different way, if I were to put it, in a very different way, in the sense that some are very rich, some are coming in from a poor background, some are from a middle background. So we're a very different group. And that's good, because that diversity is what we need in order to be able to come up with recommendations that will serve all South Africans. If all of us were the same in terms of our background, we probably would not be making a useful contribution, because we'll only serve one particular group in the country. But we'd like to serve everybody. Okay.
Just as we wrap it up, what is the spread of skills that you have in your committee, like research, academic, this, that, and the other, the various backgrounds that people bring into the fold?
Okay, we bring people from the labor movement side. Right. You have people that are pure academics. We have people that are academics in the area of growth, employment growth, and all of that. And we've got the private sector that's really looking at, issues related to wealth in this country, managing wealth, in this country. So it's quite broad, when you look at it from that point of view. And of course, you've got people that are looking at it from the youth point of view, from the NGO side and the youth point of view to say, okay, where should, things are supposed to be. Others are coming in from the education background, and some of us come in also from the health background in addition to, the other areas that I've been looking at, yeah.
Wow, Professor Shisana, thank you very much. If we had time, I would have loved to continue chatting with you about this matter. But I'm sure it's not the last time that we do talk. Time has now caught up with us. And I would like to thank you very much for your time and for all what you've shared with us.
Thank you so much. And I really appreciate this time that you've given to us.
Thank you. All the best.